Women who were diagnosed with breast cancer under the age of 50, women who were diagnosed with triple-negative breast cancer, women who have a history of breast cancer in both breasts, women who have a history of both breast and ovarian cancer, and any woman diagnosed with breast cancer at any age who has any Ashkenazi Jewish ancestry are all candidates for genetic evaluation. Other factors that are taken into account are family history. So any woman diagnosed with breast cancer who has a close relative with breast cancer, or any woman with breast cancer who has any close relative diagnosed with potentially related type of cancer, including ovarian cancer, prostate cancer, melanoma, male breast cancer, and pancreatic cancer, would all be candidates for genetic counseling. This is not an exhaustive list, so if you have any concerns about whether or not your family meets criteria for genetic counseling, I would encourage you to contact your doctor's office to walk through your personal history and your family history to make that determination. I would also recommend that for any woman who is considering genetic counseling who has a history of breast cancer, that one important step is to obtain the pathology report of your breast cancer diagnosis. As I mentioned, any woman diagnosed with triple-negative breast cancer is a candidate for genetic counseling. Triple-negative breast cancer are women who have a breast cancer diagnosis that is ER, or estrogen receptor, negative, PR, or progesterone receptor negative, and HER2/neu negative. Although many women are familiar with the hormone receptor status of their breast cancer diagnosis, some women are not informed or don't recall because the diagnosis was many years ago. If you're considering genetic counseling, I would encourage you to obtain that pathology report for your information, but also to share with your genetic counselor to assist in your risk assessment and to most accurately determine if genetic testing is indicated for you and the most appropriate type.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.